Hello, this is Dr. Susan Marra with Dr. Marra's Medical Minutes. And today we are going to talk about post-COVID complications. And those include, but there are many, many more: stroke, diabetes, hypertension, chronic fatigue, and multiple GI disorders from post-infectious irritable bowel syndrome, so alternating diarrhea and constipation. One of the reasons that there are these post-viral sequelae is because in some people the virus persists, and it most likely persists in the GI system, which is why in 60% of post-COVID patients you see post-infectious irritable bowel syndrome, because there is some evidence of remaining virus. So what do you do when you have remaining virus? Well, for one thing you want to do is you want to lower inflammation, because that's what SARS-CoV-2 does. The virus itself causes such severe inflammation on the endothelium of blood vessels that the blood vessels get so inflamed that they can't transport blood. And blood is what carries oxygen to tissues. That's why lots of patients have low O2 saturation. There's not enough oxygen being delivered to tissues because of the damage that it's done to the endothelium of blood vessels. One of the things that we're finding to be extremely helpful in post-COVID patients, and to a certain extent long-haul COVID patients, is hyperbaric oxygen. Now that should be somewhat intuitive, right? If you have a virus that causes damage to the blood vessels and hence interferes with the delivery of oxygen in the blood to tissues, perhaps one of the best ways to solve the problem is to deliver high concentrations of oxygen, which is what hyperbaric oxygen does. Hyperbaric oxygen generally takes place in a closed chamber, and you generally start at 1 atmosphere, and you sit in the chamber for about an hour, and you can do that every day. My friend, Dr. Merrill Hawley, is a hyperbaric oxygen expert, and he has a facility down in Texas that you actually can walk inside, and the entire facility is a hyperbaric oxygen chamber. We don't have that here in Seattle. We do have a few hyperbaric oxygen chambers, and I would highly recommend that you at least get a consult with someone who uses hyperbaric oxygen, because it definitely helps people with stroke, people with Alzheimer's, people with post-COVID, patients with long-haul COVID, and a host of other things like diabetes, ulcers, and even vaccine injury. I have a couple of patients who have pretty severe COVID vaccine injuries to their brain, and when they started hyperbaric oxygen, within a month, their symptoms were dramatically less, and they were higher functioning. So, take-home message is hyperbaric oxygen is probably something you should consider, and maybe ozone, although ozone doesn't have the same effect. Ozone is O3, and O3 is different than O2, okay? So ozone is better at cleaning up the blood. You can do ozone where they take your blood out, they clean it through a UV light, run some ozone in it, and put it back into your body. And I think that's a good idea as well. I did that. I went to Mexico in 2013, and after I finished a long course of treatment for tick-borne illness, and I went to Mexico and I did that, and it definitely helped. But the problem is, it didn't last. It only lasted about 6 weeks, so it was very expensive. I mean, it was $16,000 for uh, 10 weeks, so it's not insignificant, and it doesn't last. So I don't recommend ozone, but hyperbaric oxygen I think would be a really great idea for patients. So I hope this information helps you, and I hope you have a wonderful day. Thank you.